560 Millionen Menschen sind in Thailand offiziell an HIV erkrankt. Zum Vergleich, in Deutschland sind es gerade mal knapp 96.000 bei fast 15 Millionen Einwohnern mehr. Aber warum ist die Rate an Geschlechtskrankheiten in Thailand eigentlich so hoch? Was muss man darüber wissen? Was ist eigentlich mit den anderen Krankheiten wie Syphilis oder Chlamydien? Das alles beantwortet uns heute Ken. Ken ist Arzt in Pattaya und ich durfte mit ihm ein Interview zum Thema Geschlechtskrankheiten speziell in Thailand führen. Worauf muss man achten? Wie erkenne ich, ob mein Partner oder ich erkrankt sind? Das und viele weitere interessante Fragen beantwortet uns heute Ken. Jo meine Freunde, herzlich willkommen zum neuen Interview. Heute mal echt was ganz Interessantes und zwar geht es heute um eine ganz wichtige Sache, meine Freunde, Geschlechtskrankheiten. Wirklich sehr wichtig. So viele Leute gehen fahrlässig um. Ich bin heute in Pattaya und zwar bei der Topform Klinik. Hier ist ein Arzt und der hat sich bereit erklärt, mit mir ein Interview zu führen über Geschlechtskrankheiten. Ich habe gestern eine Umfrage auf Instagram gemacht, welche Fragen ihr an den Arzt hättet. Habe mir selber noch ein paar interessante Fragen überlegt. Ja, und ich würde sagen, ich gehe jetzt einfach mal rein und frage ihn alles Mögliche über STDs. Wirklich von A bis Z alles Mögliche. Und Leute, sehr wichtig, nehmt das wirklich ernst. Also ich glaube, jeder von uns hatte schon mal die Situation, wo er dachte, boah, ich hätte jetzt voll Bock, ohne Verhütung meinen Spaß zu haben oder sonst was. Leute, macht es nicht, glaubt's mir. Hört euch das Interview jetzt an, es sind bestimmt einige interessante Sachen mit dabei und wie gesagt, aufpassen, seid kein Dummi, benutzt einen Gummi und viel Spaß. Thank you for your time. We can do the interview. Can you introduce yourself, please?
My name is Ken. I'm a doctor here, working here. I graduated from Poznan University Medical in Poland.
In Poland?
Yeah.
Okay. Can I ask why?
Actually, I graduated the pharmacy here in Thailand, and I choose to study abroad to, learn new culture and healthcare system.
Okay. How is the healthcare system in Poland?
I think it's quite good.
Good?
I mean, in general, in Europe, it's much better than in Thailand because people have higher knowledge about the health, and the healthcare system itself is quite, I would say, organized than in Thailand.
Yeah, really?
Yeah.
I have other experience, like I'm from Germany, but for me it's like the healthcare in Thailand better, because in Germany you have to wait very long time till you can get to the doctor. Okay, Ken, today we talk about a very dangerous topic and very important topic, STDs.
Okay.
Because I read that Thailand is one of the countries with the highest rate of STDs. And my first question is why? Or why is like that Thailand have so much STD? What do you think?
I think I think one of the main reason is people don't really have that much awareness. Sexual protection, and the knowledge of the health system and to take care of themselves about that. That's the first thing that came to my mind. And I feel like one of the reasons, I think it linked to what you just said earlier, it's easier for them to get access to the hospital. So they don't really take care of themselves.
Okay, can I ask you, for example, in Germany, we have in the school, I don't know, maybe when you are 12, 13 years old, you have like study it, you have everything, about STDs, how to have sex, protection, how to make babies, something like that. In Thailand, have this in the school or not?
We do have that, but I can surely say that it's different than in the Western culture because we are Asians and this thing, it used to be a taboo thing to talk about. So even though we have a subject like that in school this day, they don't really talk in detail or have an open conversation with the students in Thailand. When I was in Europe, they really have a good talk and a really good structure of the course about the sexual health course for the student. So I think that's another reason that people in the Europe
maybe
I see, more aware of the.
One interesting question is, what is the most common STD?
I think the most common one is a chlamydia and the syphilis. Yeah, but the more severe one is HIV, of course, obviously. But that's the one, the chlamydia, syphilis is one of the most common.
Okay, is this, because I don't know much about STD too, is this dangerous to get chlamydia or syphilis, or I can go to doctor, take antibiotic and then it's gone, or you think is dangerous?
I think it depends. Immunocompetent, like you and me, is not that dangerous. If we detect it early, we can treat it and there's nothing left to treat. Like I mean, like there is no long-term side effect.
No, okay,
Yeah.
this is important.
Yeah, but the thing is, for chlamydia, it's hard to detect because like sometimes it doesn't show that much symptom, and people don't really feel that different.
This is my next question, like what are the symptoms? Because people ask me, hey, how I can know that I have like maybe chlamydia or syphilis? What are the most common symptoms that I know, okay, maybe I have something, I need to go to doctor?
I think the most common symptom that you can encounter is the painful when you urinate. Yeah, you're going
okay.
and you pee and then you have pain, or have like some ulcer, and I think that's the more two common symptoms that you can see. But I'm not sure about in Europe because I met many patients about like having these symptoms. So I feel like when I came back to Thailand, they don't really come to the doctor because they are quite shy about that. When you have a symptom, that leads to another problem because like we cannot detect it and we cannot treat it early on. So it causes some other long-term side effect, which is quite severe. So sometimes it involves the heart as well. Yeah, some people have a problem with the heart later on.
Okay.
In Thailand, the pharmacist itself, they can prescribe some medication for you to treat that disease as well if it's not too complicated.
Yeah, this is good. This is very good in Thailand because in Germany you need to go every time to the doctor. You cannot buy antibiotics just in the pharmacy. And this is very, very good in Thailand that you can go just to the pharmacy and they can help you. You don't need to visit a doctor. Exactly. And it's good for the privacy because I know that, like you say, many people are shy, and I think that many like tourists are shy too if they have something to go to the doctor. To tell me please some more details when I want to come to you to make a test. For example, I feel sick, I want to test like on STDs. Can you tell me how's the procedure, like how much I have to pay? And
so here in Top Form they have like a package. If you want to test, even if you don't feel sick, but you don't like you exposed to the risk, you can like come here and then get your blood tested, and then they draw your blood and then they send it to the lab, and then the lab tests it, and then
how much it costs?
So for the sexual transmitted disease is about 3,000 Thai baht.
Which diseases I get tested?
It will get tested for the syphilis and the hepatitis B, the chlamydia, and also the HIV.
Okay, so normally these are the most common. So for 3,000 I can make a completely test. How long I need to wait till I have the?
A few days, 1 to 2 days.
Okay. You think the STD rate is so high here because of the sex tourism too, and because of the freelance maybe?
Yeah. That's one thing too, because like I think it's multifactorial. Because of they don't really aware, they don't really care, and they don't really get it treated. So
okay, and what is your recommendation or a tip for someone? Like, is it enough to protect with condom, or can I get like STDs with oral or what do you think is the best way to protect myself?
Well, it's a universal recommendation that you use a condom, even though it's not 100% protection.
It's not, I know, it's not
but it's still recommended to use it. And for the question that if you can get STD via oral, it's possible, but the rate is very, very low. I would say this day medical technology has advanced a lot, and we have like the PrEP, for the STD, like the HIV for sure.
What is PrEP?
PrEP is a pre-exposure preparation, like for the HIV. So we take before we have sexual intercourse. It's one of the way that people really use it.
So I can take this before, and then I cannot give someone like, or I cannot get.
You like it reduce markedly for the rate of getting infection. I would say it's different for male to male and male to female. So technically, we know that male to female has a lower rate of getting infection, but according to the research, they not have the data to support it for the PrEP itself. So for men to female, we recommend you to take the PrEP every day.
I never hear about it.
But for the male to male, they have two regimen: the everyday regimen and like emergency regimen as well. But for the rest, like syphilis and chlamydia and other thing, I think it's treatable. And if you get it treated early, it's fine.
Okay. What is about the percentage, the rate? Have more male or female STDs in Thailand?
I would say it's the same according to my experience. But in real life, male to male much higher because the way they have the activities is different because like in the male to female, the physiology of the female, they have like the protect mechanism
I understand.
by themselves. Yeah, so
because like
male,
naturally,
exactly.
Yeah.
But for male to male, it's different. So
and can you tell me what was like your craziest experience with a client? With STDs. What was maybe? Can you tell me maybe one two stories? Or
it's a little bit crazy for me because I've never seen that, but maybe it's not for many people. Like a guy who came in with like ulcer and everything, and he said like he never had sex, which is like impossible. And it's just like if you have something, you just tell me. I'm not gonna tell anybody. Just
don't be shy.
Exactly. And like he also had like the ulcer at the back as well. And when I asked about like about sexual partner, he said he never had it. If he would have, he would go for a woman, which is quite stupid to say that because like you already have the disease itself.
Okay.
In the front and in the back, just like you don't have really how to lie about that.
Okay, I understand. And more older men or more younger men come to you?
Actually, is younger.
Younger? Yeah. I think the same.
Younger people, they enjoy their life. I mean, like they haven't had that experience yet, but the older people, they already have some experience that they already know.
Okay. I have one interesting question because I see this a lot and many friends tell me, for example, when I have sex with a woman and she go to shower, but I can smell like not normal smell from her. Is this a sign that she has STD or not?
It could be and it could be not. I would say in two different aspects. The first aspect, if she has an STD, that could be the smell that you smell it. Like some of the infection, if they have like a pus or they have like something going on, it could cause a smell as well. But the other part is about the hygienic. Maybe she doesn't have any symptom or any diseases at all, but the hygienic is not that good. It could cause the smell as well. It depends. But if you see like she has ulcer or maybe like some discharge that's smell really bad, the fishy smell.
She go shower before, and then I think it cannot be because of the hygiene. It's need to be something else, maybe,
So, but for sure, the smell can be like it happening in the healthy female as well. But it's not like a fishy smell or something like that. And
because a lot of people ask me, hey Michael, how I can know that maybe this girl has STD or not? I say
I would say that's quite impossible unless you see the ulcer.
Because many people I think have STDs, but they don't know it.
Really know.
Because they not have symptoms. This is the big problem. So if someone not feel good, they can come like to your clinic, for example, and can do a check like for 3,000 baht. They can make a completely blood check. I can check every STD with blood or
no? It's impossible. It's just some of the diseases that you can check. Like it's not available. It's not only in the clinic. Some of the diseases is not available, like in Thailand or the whole world.
But the most important are like this, what you show me, and I can test for 3,000 baht. Okay, Ken, my last question is, what is the most dangerous STD I can get? Is this HIV or you think have more dangerous? What is the most dangerous I can get?
For me, I feel like the HIV is the most dangerous one. Even though like this day, with the advanced medical technology, like the lifespan of the people who had HIV is extended, but it's still the most dangerous one in my opinion because like when you get the HIV, eventually you will get worse. Your health will get worse, and other diseases like tuberculosis, like the TB, and candidiasis or any other diseases, it could like swarm at you and you get like lots of infection. So for me, it's the more dangerous one, and it's not curable.
I see. Maybe because the problem is that maybe some people have HIV, but they don't know it because they don't have symptoms yet.
I got the patient yesterday. She doesn't.
Really?
Yeah, she didn't know that she had the HIV. Like the first diagnosis, she was quite shocked. But like really, eventually she accepted it and then get treated. I think it's a really dangerous one.
Okay, Ken, thank you for the answers and thank you for the interview.
Thank you for your question as well. I really like your question.
Thank you, Ken.
Thank you.
Meine Freunde, ich hoffe, das Interview hat euch gefallen. Ihr konntet einiges mitnehmen. Meine abschließenden Worte: sei kein Dummi, mach's mit Gummi. Abonniere meinen Kanal, like das Video und wir sehen uns beim nächsten Mal. Haut's rein.